Hey everyone, Dr. Mike here, and let's talk about something that sounds like it's straight out of a sci-fi movie, but is actually revolutionizing the way we approach healthcare artificial intelligence. We're talking algorithms that can analyze massive amounts of data in seconds, learn from it, and help doctors make better decisions faster. This isn't about replacing doctors, it's about giving us superpowers to diagnose earlier, treat more effectively, and ultimately save more lives. From reading scans to developing new drugs, get ready to have your mind blown. Let's face it, making a diagnosis isn't always easy. It's like putting together a puzzle with a million pieces. And sometimes those pieces are really, really small. But what if you had an assistant who could look at all those pieces at once, connect the dots, and point you in the right direction? That's what AI is doing for diagnosis. Imagine feeding thousands of medical images, symptoms, and lab results into a system that can analyze them with incredible speed and accuracy. We're talking about algorithms that can detect subtle patterns in imaging that might be missed by the human eye, catching diseases like cancer in their earliest, most treatable stages. AI can help us avoid those frustrating diagnostic dead ends. You know, when you're running test after test and it feels like you're going in circles. AI can analyze all the data, suggest the most likely culprits, and help us get to the bottom of things faster. Think about conditions like diabetic retinopathy, a complication of diabetes that can lead to blindness. AI algorithms can now analyze retinal images and detect this condition with remarkable accuracy, often earlier than traditional methods. Or how about heart arrhythmias? AI can analyze EKGs with incredible precision, identifying irregular heartbeats that might be missed by the human eye. This early detection can be life-saving, allowing for timely intervention and preventing serious complications. We're all unique, right? So why should everyone with the same condition get the same treatment plan? It's like assuming one size fits all when it comes to clothes. It just doesn't work. That's where AI comes in, bringing the era of personalized medicine to life. We're talking about tailoring treatment plans to your specific genes, lifestyle, and even your environment. Imagine this. You're diagnosed with a certain type of cancer. In the past, the treatment plan might have been pretty standard. But with AI, we can now analyze your tumor's genetic makeup, your medical history, even your lifestyle factors, and create a treatment plan that's specifically designed for you. This means more effective treatments, fewer side effects, and better outcomes. It's like having a team of experts crafting a treatment plan just for you, using all the data points that make you, well, you. And this isn't just limited to cancer. Think about chronic diseases like diabetes or heart disease. AI can analyze your blood sugar levels, activity levels, and even your sleep patterns to create a truly personalized management plan. Medical imaging is like the window into our bodies, giving doctors a glimpse of what's going on inside. But sometimes those images can be hard to interpret, even for the most experienced eyes. It's like trying to find a needle in a haystack, except the haystack is your insides, and the needle is a tiny abnormality. But what if we could enhance those images, make them clearer, and highlight the areas that need attention? That's where AI is stepping in, acting like a super-powered magnifying glass for medical imaging. We're talking about algorithms that can analyze CT scans, MRIs, and X-rays with incredible detail, identifying subtle patterns and anomalies that might be missed by the human eye. This means earlier detection of diseases like cancer, stroke, and heart disease when treatment is most effective. AI can also help us monitor the progression of diseases and track the effectiveness of treatments. Imagine being able to see how well a tumor is responding to chemotherapy, or whether a new medication is actually slowing the progression of a disease. AI can also help us reduce the radiation exposure associated with some imaging techniques. By optimizing image quality and reducing the need for repeat scans, we can minimize the potential risks to patients. Remember that feeling when you walk into a doctor's office and they greet you by name, remembering details about your life and medical history? It makes you feel seen, heard, and cared for, right? Now imagine that level of personalized attention, but amplified by the power of AI. We're talking about a future where AI assists with everything from scheduling appointments to monitoring your vital signs, freeing up healthcare professionals to focus on what they do best, connecting with patients on a human level. Imagine this, you're wearing a wearable device that tracks your heart rate, sleep patterns, and activity levels, This data is then analyzed by AI, which can detect any unusual patterns or potential red flags. If something seems off, the AI can alert your doctor, who can then reach out to you proactively. This means catching potential problems early on before they become serious and avoiding those last-minute trips to the ER. It's like having a personal health assistant available 24/7, keeping an eye on your well-being and providing valuable insights to your healthcare team. AI can also help us manage chronic conditions more effectively. Imagine a world where AI-powered apps remind you to take your medication, track your blood sugar levels, and even provide personalized coaching and support. Developing new drugs and therapies is a long, complex, and often frustrating process. It's like searching for a needle in a haystack, except the haystack is massive and the needle is constantly moving. But what if we had a tool that could help us sift through the hay faster, identify the most promising leads, and accelerate the development of life-saving treatments? That's the promise of AI in drug discovery and development. We're talking about algorithms that can analyze massive data sets of genetic information, clinical trial data, and even scientific literature to identify potential drug targets and predict the effectiveness of new therapies. This means we can focus our resources on the most promising avenues of research, potentially shaving years off the drug development timeline and bringing new treatments to patients faster. AI can also help us design more effective and targeted therapies. By analyzing the specific molecular mechanisms of diseases, AI can help us develop drugs that are tailored to attack those mechanisms with greater precision, reducing side effects and improving outcomes. Imagine a world where we can develop personalized cancer vaccines based on the unique genetic makeup of a patient's tumor, or design drugs that target the specific proteins responsible for neurodegenerative diseases like Alzheimer's. So there you have it, 5 incredible ways AI is revolutionizing healthcare. From improving diagnostic accuracy to accelerating drug discovery, AI is poised to transform the way we prevent, diagnose, and treat diseases. And this is just the beginning. As AI technology continues to evolve, we can expect even more groundbreaking advancements in the years to come. Imagine a future where AI helps us predict and prevent diseases before they even occur, or create personalized virtual health assistants that provide 24/7 support and guidance. The possibilities are truly limitless.